I want to talk about 3 things that you really need to focus on to try and increase your pass and increase your score when it comes to the PLAB1 exam. I'm Dr. Arora from Arora Medical Education. I get asked lots of questions about PLAB1, and these are 3 things that I think people don't focus on enough that can really help to maximize your score. We're currently vacationing in Goa right now. It's super hot, it's super humid, it's an amazing place to be. But the 3 things that I'm going to focus on in this particular video are: number 1, strengthening your problem-solving ability; number 2, strengthening your core knowledge base; and number 3, strengthening your exam technique. Let's go. So the first thing I want to talk about, a really important thing when it comes to PLAB1, is strengthening your problem-solving ability. Now, a lot of people, when they do preparation for PLAB1, they do lots of questions, of course. There are question banks out there. We have our own mock exams for PLAB1, and people do lots of different questions. Now, when people do questions, they tend to think that they're being tested on knowledge. Now, when it comes to PLAB1, they kind of assume that you have a certain level of knowledge. It's not just testing your ability to understand 15 causes of left-sided heart failure, okay? They kind of understand that you have a little bit of baseline knowledge, having done medical school, final medical exams, etc. This is testing application of your knowledge. So you have to work on strengthening your problem-solving ability. So for example, you get a situation described to you in a question, and it may seem that there are possibly 2, maybe even 3 potentially correct answers, and your knowledge will get you so far. Your knowledge may knock away 2 or 3 answers. But remember, out of the 5, you might find 2 that you're thinking 50-50. Now, having more knowledge is not going to help you make that decision, but your problem-solving ability is going to help you make that decision. So one thing you're practicing when you practice your questions and doing mocks, for example, make sure you're trying to work out, when you get those kind of questions where you're a little bit stuck, don't just guess, because guessing obviously gives you a 50% chance of getting it wrong, or even a more than that percent if you're guessing out of 3. Make sure you really hone your ability to, under pressure, in time pressurized situations, problem solve. Now, this works from 2 angles. There's the knowledge side of things, we'll talk about in a second, and there's also the technique side of things as well. But I really see people not focusing enough on strengthening their problem solving skills through improving technique and through improving knowledge. We'll talk about in a short second. But so when you do your preparation, please focus on, when you get down to those really tricky questions, don't just guess them and hope that in the exam you'll get them right. Work on, how can I problem solve this? It's not testing my knowledge, it's going beyond that. I've got to be able to work out certain things from the information that I have. That's a different skill to just knowledge, but very important when it comes to PLAB1. Now, moving on to number 2 then, based on the first one, which is you need to improve your ability to problem solve. Of course, you've got to improve your knowledge base. Now, we talk about a dual-based approach when it comes to PLAB1 preparation. Number 1, yes, do lots of questions, and number 2, focus on technique. But this bit is the questions bit, the knowledge bit. But also, you shouldn't just be doing questions, because you can't rely on questions in a question bank to get you to the stage where your knowledge is enough. Of course, medicine is vast. There is a PLAB1 blueprint, there's a GMC PLAB1 blueprint. It tells you all the different things that you need to be knowing before you walk into that exam. So unless you find a way to boost your knowledge in a different way to relying on question banks, you're going to probably have gaps in your knowledge that are going to cause you problems when it comes to the exam. Now, if you do, I don't know, 5 or 6 different, sorry, it's really hot, 5 or 6 different question banks, okay, you might have a really good core knowledge base for all the core conditions. I don't know, hypertension, asthma, AF, acutely unwell patient, for example, because those questions are covered a lot in the question banks. But a question bank can't cover every single part of the curriculum. It can't cover every single thing that you need to know from a knowledge point of view when it comes to exam. Because even if you have 3,000 questions, 10,000 questions, there are going to be gaps. And let's be honest, most question banks are going to focus on those kind of high yield areas, chronic disease, acute management, and they're not going to have enough questions to cover every single condition. So in some way, you've got to be boosting your knowledge. So maybe when you do 100 questions, maybe it's worth doing a bit of time on some background reading, background knowledge, going through guidelines, going through material, whether that be things like textbooks, whether it be going something like our PLAB1 online course, where we teach you all the material that you need to know, whether it's PLAB1 audiobooks, whether it's going through, textbooks of your own back from medical school days. You've got to find a way to increase your knowledge base and not just rely on questions from question banks. Because if you do questions from question banks and you read the bit at the bottom below a question, you learn that bit very well. Say you're doing a question on hypertension diagnosis. You learn a little bit about hypertension diagnosis. Then you do another question later on about hypertension I don't know, guidelines for management. You'll learn that little section for hypertension guidelines for management. But what about the bits in between? There's lots in a clinical guideline that you can't expect a question bank to have covered every single step. And that's why having a strong knowledge base is very important. And one thing you should really be focusing on when you're preparing for PLAB 1 is not just doing thousands of questions and hoping that your knowledge is going to be okay. It's about doing a little bit of work outside that, reading, revising, going through, listening, watching videos that cover the rest of your knowledge base. That's one thing I really would focus on when it comes to your PLAB 1 preparation. And very quickly, the third thing, before I start to melt in this scorching Goa sun, the third thing that I would really focus on is improving your PLAB 1 technique. Now, it's one thing to have a really strong knowledge base, and lots of people may have that. It's one thing to be able to problem solve under pressure and work out certain things from background knowledge. But the third thing that people don't often focus on is exam technique. And one thing we do a lot of teaching on when it comes to things like our PLAB 1 mocks, for example, or our PLAB 1 webinars I hope you guys are using, we talk a lot about technique, okay? How can you use certain things in the question to help you determine the right answer? So your knowledge will take you so far, but say you get down to two answers and you're not quite sure which one it is. You could problem solve a little bit and try and use your application of knowledge to understand. But even if you can't do that, what about technique? What words in the question give things away in terms of this is right versus this is right? You know, things that we commonly talk about are things like small words versus big words. The fact that our brain doesn't look at small words, it looks at big words. Look at the small words, they can really help. Are they soft words? Are they hard words? Things like, you know, can, may, often versus, you know, always or never. These kind of things are very important to pick up. You know, double words in a question, can I change them to a single word to put less pressure on my brain? Which of these is least appropriate? Change that into false, for example. These kind of things are technique. Now, you can do all the work that you want, you can do all the reading that you want, you can do all the questions that you want, but if you don't start to look at what technique areas do I lack in and how can I work on those, then you're probably going to let a lot of marks or leave a lot of marks on the table when it comes around to the actual PLAB 1 exam, okay? So technique is really important, and we do a lot of teaching around that. Go to some of our webinars that are on our YouTube channel, and you should see a lot of work that we do in terms of teaching about technique, okay? So 3 things are really important to focus on if you want to maximize your PLAB 1 score. Number 1, strengthen your problem solving ability. Number 2, strengthen your core knowledge base. And number 3, strengthen your technique when it comes to answering questions. Now, we do loads of teaching on all of these things, whether it's things like our PLAB 1 Gold Package, our PLAB 1 online course, our PLAB 1 audiobook, our PLAB 1 mock exams, our PLAB 1 flashcards, and even our free PLAB 1 webinars that hopefully you've been attending at some point in your preparation. If you want to get any of those, please do use the coupon Arora Video 10, ARORA VIDEO 10 for 10% off any of those resources for PLAB 1 on the Arora Medical Education website. But please, 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 if you're preparing for PLAB 1 right now, I hope your preparation is going well. I hope we can help you in some way maximize your score, and I hope then we can set you up for PLAB 2 and beyond in terms of your career in the NHS. Remember those 3 things, okay? Strengthen your problem-solving ability, strengthen your core knowledge base, and strengthen your exam technique. I'm Dr. Arora from Arora Medical Education. Hashtag CAMPASS will pass. Hashtag I went with Arora. Have a beautiful day. Goodbye from lovely, hot, humid, but amazing Goa. Take care.